Hi, I'm Dr. Ashok Raju Gottamukala. I'm the head of the Department of Orthopedics at Citizens Hospital. I specialize in hip surgeries and trauma in orthopedics. Today we are going to talk about a topic called as avascular necrosis of the femoral head. So what is avascular necrosis? Avascular necrosis is nothing but if you look at the hip joint, this is the ball part of it, what we call as the femoral head, and this is the acetabular part, which join together to form the hip joint. The blood supply to the femoral head or the ball of the femoral head of the hip joint is disrupted or is lost in case of avascular necrosis. So what does it lead to? It leads to a dead bone which can collapse at a later date as you walk, leading to what is called as arthritis of the hip. So let's look into what are the causes of avascular necrosis. The most common cause, most of the time we do not know what it is, the reason for it. So it is called as idiopathic. The other reasons are excessive consumption alcohol, or if you are on high doses of steroid for any of the medical management, is again a cause for avascular necrosis. But recently, I think COVID and its treatment are one of the major causes for developing avascular necrosis. So what do the patients present with in case of AVN? I think most of the patients do not have any symptoms in the initial stages. It is only later in the development of AVN that patients complain of pain in the hip joint, and they have difficulty in walking and difficulty in getting up and out of the chair and doing their regular activities at home. And they might also have pain while turning in bed. So how do we know that we have avascular necrosis? The best modality of investigation through which you will know that you have the AVN is only by clinical examination, one, and second is through MRI of pelvis with both the hip joints. So now what is the treatment for avascular necrosis? There are two methods of treatment, one medical management, the other one is surgical. I think the surgical management is a preferred method if you are in an early stage of avascular necrosis. In the early stages of avascular necrosis, that is stage 1 and 2, I think there's something called as co-decompression, wherein the pressure in the femoral head is increased. So you drill holes into the femoral head and neck so that in an attempt to increase the vascularity of the femoral head. To this you can add what is called as stem cell therapy also to improve your outcomes. But if your stage is crossed to 3 and 4, where you are developing arthritis, where there is damage to the cartilage of the femoral head or the acetabulum, there is no way to preserve the femoral head. It is only by replacing your femoral head. So you need to do what is called as total hip replacement. So coming to the medical management, people who are unfit for surgical management, who need time to think about the surgical management, they are generally put on what is called as bisphosphonates and calcium tablets. So why are we talking about avascular necrosis? That is because of late, because of the COVID and its treatment, we are seeing an increased number of avascular necrosis. These patients are generally complaining of vague pain in the hip. They assume that it is kind of some sprain around the hip joint and try to neglect it. If you recognize this avascular necrosis at an early stage, we can preserve your hip joint by doing what is called as co-decompression, and you can avoid what is replacement, that is total hip replacement. So this is an extremely brief explanation or knowledge about avascular necrosis. Thank you very much.